Those taking part in Dry July have less than 10 days to go until their alcohol-free month is over, but health groups are advising Australians to rethink their drinking habits when the challenge is over. Joining us live now is Peter Hayton, Chief Psychologist at the Banyans Healthcare. Peter, thank you so much for your time this afternoon. For those taking part in Dry July, why is it a good circuit breaker?
Yeah, Gab, here we are at the end of Dry July, and if people have been successful, they've taken a few weeks away from alcohol, and that's a great circuit breaker because it starts to change the habits. And we know that habitual drinking is the real issue for us, and we want to kind of shift that. Of course, some people have moved into Dry July and they haven't been successful. They haven't made it this far, and they're not going to make it through. And we probably want to ask them questions about that and, what we can do about those kind of things as well.
So how do you know if drinking is part of your life because it's social, it's a bit of fun? How do you know if it is just harmless or if you actually have a dependency on it?
Yeah, I think that's the thing, isn't it? It's hard to work that out. It's very subtle. And a lot of the times when we've got that problematic drinking, we're hiding it away and we're not even acknowledging it to ourselves. And so what we want to do is have a think about, how much we're drinking, how often we're drinking. You see, this is the issue, I think, for us as Aussies. Alcohol is a big part of our culture. We've got a couple of bottle shops on every corner. We don't mind a drink and we kind of use it to celebrate a little bit. The message about smoking in our society has got really clear. It's not good for us. The message about alcohol and the risks that are involved, that's less clear. And we don't understand what problematic drinking does for us. And when you look at what's recommended, it's pretty easy to kind of get away and have drinking become problematic.
Can you expand on that? What are the long-term impacts of excessive drinking?
Yeah, it's both biological, social, and psychological. So all of those together. We know that when we have problematic drinking, our social worlds become really disrupted. The focus on our family, and we don't have to be drinking too much for that alcohol to take the attention away from our family. We could be coming home from work, having a few drinks, falling asleep on the lounge, and we're not there for our kids. We're not there for our family, and straight away that alcohol, even at low levels, is starting to have an impact on that social kind of aspect. We have a think about what happens with the body. The issue with alcohol is that biologically we get used to the drinking. Look, anyone who's a drinker has probably been out and they've had a big night and felt sick the next day and had a bit of a hangover. And that's because alcohol has toxin in it and it has an effect on our biological systems. And when we increase that by the frequency or the severity, we have too many of those big nights, like those binges, then that has a real strong negative effect on our biological systems. And of course, psychologically, we start to feel really helpless when something's got a grip of us and we know that there's an issue there and we can't get away from it.
So what advice do you have if someone is struggling with it? What steps can they take?
Yeah, I think what we want to do is have a think about how do I change a habit? And to do that, we know that some good support and help is really useful for us. Sometimes we need to get some professionals involved. A lot of the time, I think it's great to have a chat to our GPs. Our GPs are really well qualified. And I feel like in Australia, we've got really great capacity to avail ourselves of really good medical and social services where you can't get that in other countries. And we should really look at getting involved in that. Sometimes we can even get online and look at some really great support services online and get that support. I think when we're drinking too much, it's kind of like when we're starting to use the alcohol as an emotional crutch where we're doing something for the effect. And when that's happening, that's when we probably need to get online, go and see our GP and be really honest and say, hey, this is kind of how much I'm drinking. What's the recommended amount? And get an understanding about that and then go from there.
What if you're worried about a friend or a family member and they're not quite ready to maybe admit that to themselves or take those steps? What can you do?
Yeah, Gab, I think this is where we've got to be really sensitive. We want to be able to listen. We've got to be careful not to judge them and push them. We know that the cycle of change when it comes to dealing with things like alcohol really requires us to take ownership for ourselves, but to be able to care for them, talk to them in that caring way where we're bringing up the issues. We're saying things like, hey, I've noticed this kind of concern. Are you worried about that at all? I've found these kind of supports. I wonder if they might be useful for you. Should that be something we have a look at together? Can we make a call together? Can I go to the GP with you together to be able to talk about those kind of things? And what that does when that person says yes and they're open to that, and we go and get on the phone or we see the doctor's got somebody else there with some other information, and it's easier for that person then to kind of disclose what's going on for them.
Sometimes a difficult conversation, but no doubt an important one. Peter, thank you so much for your time. We appreciate it.
Thank you, Gab. Great to have been with you.